My guest, Dr. Mary Menz, a board-certified cardiologist with Morris Hospital Cardiovascular Specialists. Dr. Menz is accepting new patients at her Shanahan, Morris, and Ottawa offices. To schedule an appointment with Dr. Mary Menz, you can call 815-705-1000. As we're into the month of February, American Heart Month, and this morning we're going to focus in on women's heart health.
Yes, because women's heart health is very important, and despite our recent pandemic, it does remain the number one killer of women and men in this country. And even though we've had spotlights on cardiovascular disease for years, still only about half of women realize that heart disease is their number one risk for death.
All right, and something else we've learned about disease in general is prevention seems to be the way to go. So what can we do to help prevent heart disease?
Well, there's a number of things. I always tell patients that the biggest thing you can do to help prevent heart disease is just have knowledge. You know, knowledge is definitely power. And you need to know your numbers. You need to know what your blood pressure runs and whether or not you have high blood pressure. You need to know what your cholesterol is and whether or not you have normal cholesterol or abnormal cholesterol readings. You need to know what your blood sugar is and whether or not you're a diabetes, because those are three of the most important risk factors for heart disease. And, of course, if you're a smoker, you need to know that you should quit. But knowing your numbers and talking to your doctor about ways to get abnormal readings under control are extremely important in preventing heart disease in the future.
All right. Well, I think we may have alluded to this a little earlier, but how serious of a problem is heart disease in women?
Well, it is the number one killer of women in this country. 2019 is the most recent year I have statistics from the CDC, and it did account for 301,000 deaths in this country, which is 1 in every 5 deaths in women. So 20% of all deaths in this country are caused by cardiovascular disease in women. That's a huge number.
Yeah, it sure is. Well, are signs and symptoms of any heart issues in women different than they are, say, in men?
Well, a lot of the signs and symptoms are the same. You know, obviously you can have chest pain that radiates into your back or your jaw or your neck. But the most common presenting symptom for heart disease in women is actually overwhelming fatigue. And that fatigue predates overt symptoms of chest pain or shortness of breath by weeks to months often. And it's something that, you know, it's not just the usual tired, because most of us are tired. You know, we have jobs, we have families, we have things we take care of. But this is, I can do a load of laundry and I'm just exhausted and I have to sit down and rest. Or I make it through my workday, but by the time I get home, I can't do anything else because I'm so tired. And if you're experiencing that kind of fatigue, it is something that you should take seriously and see your doctor about, because it can be a sign that you've developed cardiovascular disease.
Okay, so that, and say shortness of breath as well?
Yes, absolutely.
Yeah, when trying to complete a task or something?
Yes, shortness of breath, especially with like your normal daily activities. So assuming your laundry's in the basement and you go up and down the stairs to do laundry, and now all of a sudden you're finding, wow, I have to work a little harder to do that. Yeah, that's an important symptom.
Gotcha. Well, what can we do if we are diagnosed with heart problems?
Well, the best thing to do is work with your doctor to treat whatever heart problems are found. You know, if you have blockages in the arteries, there are a lot of ways to handle that with medications, stents, even bypass surgery. Once the acute problem is diagnosed, then it becomes management of the underlying reason for why you developed heart disease. So just like we spoke about a little bit ago, managing your blood pressure, managing diabetes, managing cholesterol levels, but also managing your stress level is very important, and you have to find healthy ways to cope with that stress. Getting regular physical activity is extremely important, and it's something that I can't emphasize enough. I am a reformed couch potato, and now I exercise every single day. If you had told me a year ago I would run 3 miles before work every day, I would have laughed at you.
Right.
But since I've started doing it, I can't begin to tell you how much better I feel. So getting that physical activity is hugely important, and we know that a minimum of 150 minutes a week will at least maintain the physical fitness level that you're at. If you want to become healthier, you need to go over and above that 150 minutes. We really like for people to get at least 2 hours and 30 minutes a week, which is that 150 minutes. I always tell my patients it's 22 minutes a day. You can do anything for 22 minutes a day, and you can find 22 minutes to walk or 22 minutes to pedal on a foot pedal or just anything that gets your heart rate up, gets a little bit of sweat going. Very important. And then, of course, our diet is extremely important, too. You know, choosing healthy food and drink, trying to stay away from extremely processed foods or things that have a lot of chemicals in them, and trying to eat a diet that is more geared towards vegetables and fresh things rather than meats and things like that. So you don't have to go completely vegan or vegetarian, but having a more plant-based diet definitely does decrease your risk of heart disease.
And does that include even more so than hey, eat your fruits and veggies? Is it beyond that?
It is beyond that.
Okay.
I know, and then we're in the Midwest, so that's a hard thing to do.
Right.
But making a choice at least to have your plate at your meals geared more towards the vegetables and the fruits, and limit the amount of meat that you have. You know, really, I try to tell people red meat's bad. I mean, we know red meat is bad.
Right.
It doesn't mean you can't ever have it, but you really need to limit it to that once a month kind of a thing. You know, try to choose fish whenever you can. Fish is one of the healthier options if you're looking at continuing to maintain some sort of animal protein in your diet. But the more plant-based you get, the healthier it is and the better it is for your cholesterol.
Okay, very good. And I guess bottom line, if anything else, start with getting a blood test and getting your BP taken, right?
Absolutely. Those are, really important, simple things to do. They just take a few minutes. And even if it's, walking into Walmart and sticking your arm in that blood pressure cuff to see where you're at, it's a good start, step in the right direction.
Okay.
I really appreciate you giving me the time to talk about getting people healthy because, ultimately it's easier to prevent it than it is to treat it once you have it.
Right,
so the sooner you start getting healthy, the better.
Very good. Morris Hospital's cardiovascular specialist team is comprised of 7 highly skilled cardiologists and 1 very experienced nurse practitioner specializing in cardiology. They are your trusted local resource for compassionate heart care from routine concerns to complex heart conditions. Morris Hospital's comprehensive heart care includes extensive diagnostic testing and advanced treatment in their state-of-the-art cardiac catheterization lab. The Morris Hospital cardiology team stands ready 24/7 to perform advanced life-saving procedures. To learn more about the cardiovascular specialists of Morris Hospital, go to morrishospital.org or call 815-705-1000.